If you can't get a good night's sleep, you're not alone. Thousands of people have conditions that interrupt their sleep at night, leaving them always tired during the day. Dr. Bruce Sofferman is a clinical professor who specializes in sleep apnea, TMD, and oral facial pain, and is the owner of Sofferman Sleep Solutions. Doctor, thanks for being here.
Thank you. Good morning.
So I understand you just got back from the American Medical Dental Sleep Conference in Boston.
Yes. It was very interesting. We always try to get the latest techniques and be on the cutting edge of all sleep problems.
Yeah, you want to be up to date, so that's fantastic. So we're having you back today because the first time you were on the show, you were inundated with questions.
Yes.
So we're going to go through some of those today.
Okay.
Let's get right to it. Is sleep apnea and sleep disordered breathing an old age or weight-related problem?
Sometimes there is an involvement with weight and old age, but it doesn't have to be. I have many patients that are just thin, young, vibrant women, but it's a disease of obstruction of an airway, where there's just not enough air to bring in.
And you can be thin, you can weigh anything?
You can be thin.
Okay. So it's irrelevant there, and it doesn't matter what age you are?
No, it really doesn't matter what age you are. As a matter of fact, at the meeting we were talking a lot about young children, where they're developing sleep apnea at young ages.
Well, let's talk about the signs of sleep apnea.
Okay. The first sign is snoring. If you're snoring at night, that should ring a bell that there could be something wrong. However, be careful. Just don't go out and get yourself a snoring appliance, because you could be masking a disease, which is the sleep apnea.
Okay.
Also, if you wake up in the morning and you have headaches, you wake up tired, you're just not refreshed, you're not ready to start your day, you're not ready to go to the gym, you're not ready to get in your car.
You just want to go back to bed.
You just want to go back to bed. That's another issue and a problem that could be a real warning sign. Also, 2, 3 in the afternoon, you need that coffee to get you by, or those 4 or 5 chocolate bars. More serious signs are when I have patients that have to pull over on the side of the road, even though their air conditioning is on high and they're singing, but they're so tired.
All the tricks of the trade, right?
That they feel like they can't even make it home, or they fall asleep at a stop sign.
That's dangerous.
Yes,
it is a big problem. It's not just being groggy and tired.
No, it's not being groggy and tired.
Okay. Well, let's go into more detail why the lack of sleep is detrimental to one's health. I mean, I read an article this morning. It causes anxiety. It really affects your overall health.
You know, the lack of sleep does affect your overall health. Well, think about it. You're waking up in the morning and you're not refreshed. It's depressing.
Sure it is.
There are things you want to do, and in our world, the way things are these days, you have a lot more to do than we did even 10 years ago, just to keep up with our economy, the kids, school,
and it all starts with a good night's sleep,
and it all starts with a good night's sleep. And you have to replenish your organs. People have to remember that if you have obstructive sleep apnea, it's affecting your whole body.
Okay, and if you do have sleep apnea, what should you do?
I would see my internist, my pulmonologist, my ear, nose, and throat doctor, and then he'll probably send you, or she'll send you for a sleep study, and then they'll probably put you on what we call a continuous positive air pressure machine, which is called a CPAP. If you can use that CPAP and you're diagnosed, stay on it. It's wonderful. But if you can't, you have to know in the back of your mind that there's an alternative. A simple dental appliance could be the solution. Okay.
But you say that people have a CPAP, but they don't use it.
You know, we have so many calls. We get calls. My brother's in my room. He's snoring. He has a CPAP. He's not using it. My wife, my uncle. Obstructive sleep apnea, unfortunately, is a disease, a diagnosed disease. Though you may not feel it today, you just feel tired. Your organs aren't properly resting. At night, your heart is overworking, your chest is trying to get air and it's overworking, and it depletes the body. And that's unfortunately why when I saw a few patients, young men in their 30s and 40s having heart issues with no previous heart conditions, having heart attacks or possibly a stroke, you say, why is this happening? And it's due to sleep apnea at sometimes.
But you mentioned you have an alternative to the CPAP.
Yes. People you need to know that there is an alternative. That means if you're diagnosed with sleep apnea and you can wear that CPAP machine, it's wonderful. You don't go off that CPAP machine. If there are other things and problems like you're overweight and you lose the weight, yes, maybe then you can get another sleep study and then try to get off the machine.
Okay.
But I'm talking to the 60 or 70% of the people who after 6 months cannot wear that machine. It has its own issues, as wonderful as it is, but it's our 100% bulletproof way of stopping apnea. But if your CPAP is under your bed or in your closet, you need to know there is an alternative.
Okay.
And that alternative is a dental appliance.
And is it hard to be fit for, or is it?
No, it's very easy to be fit for.
Okay. Is there a demonstration you could show us?
Yes. Well, I could show you a dental appliance.
Okay.
And show you how easy it is to. I wasn't planning on putting it in, but this is the dental appliance.
Oh, okay.
Okay. And this is how it goes in.
And you just sleep like that?
You just sleep like that.
Got it. Okay. Very good.
Okay.
Now, is this something that Medicare would cover?
You know, Medicare does cover that in 100% in full, and so does, we work with a lot of insurance companies because they know that there's a problem.
Okay.
Like, let me just demonstrate the problem here.
Absolutely.
You know, usually we're sitting up, we're breathing fine. Okay? Now, what happens is we say, you know what, we're going to just take a nap or go to sleep at night. So when we go to sleep at night, we tilt our head on the bed, and we're still breathing fine because we're consciously awake. However, as the night progresses, as the deeper sleep that you get into, and notice, this is the airway when you're conscious. It's not that big to begin with.
Right.
So your lower jaw starts falling back, and as you get into deeper and deeper sleep, your tongue goes way back, touching some of the throat tissues, which actually causes the blockage.
I see.
And that is why people have sleep apnea. It's a cessation of breath for 10 seconds. So now, if we put this back in, the device just holds your jaw forward and gives you back your airway.
Ah, it makes sense. Very good. It's much easier to see with the demonstration there, Doctor. I just want to remind all of our viewers that on Wednesday afternoons and Thursday mornings you have open houses where people can come and ask questions.
Absolutely. And we also, I'd also like to tell all our viewers that we have a wonderful staff.
Okay.
You do not be afraid to call with these questions.
Very good. In fact, we have all that information on the screen. We could call your office in Derby. It's 203-734-6000, or visit soffermansleep.com.
But don't be afraid to ask for me.
Got it.
Marie or Jennifer will take your name and number. I will not probably be able to talk to you that second, but I answer all my calls after work.
Sounds good, Doctor. Thank you so much for being here, and stay